COVID-19 and HIV/AIDS. Global Concerns, Prevention and Control. Prepared by D.A. Salem, Director of the International Institute of Risk Management Sciences. Preamble. On this video and those that will follow, you will find information and advice concerning the two pandemics that have troubled the world, namely, COVID-19. The first cases of which were first reported in Wuhan, China on December 31, 2019. HIV/AIDS, which is celebrated today as World Day December 1st. Our videos are broadcast in 14 languages and updated regularly. We invite you to subscribe now. Our research is inspired by several sources, including press conferences of the World Health Organization and certain international organizations which work in close collaboration with world experts, governments and their partners to rapidly expand scientific knowledge on these two viruses. It is therefore a question of monitoring the spread and virulence of these viruses and of giving advice on the measures to be taken to protect populations and prevent the spread of this outbreak of COVID-19 as well as the persistence of HIV/AIDS despite progress achieved so far. Summary of the press conference on the COVID-19 pandemic organized at the World Health Organization on Friday, November 27, 2020. The speaker is Dr. Tedros, Director General of the World Health Organization. Dr. Tedros said in this lecture the following: COVID-19 is a pandemic that is chaotic and disorderly. All countries have been affected, but not in the same way. More precisely, 70% of cases are listed in only 4 countries. Many believe the pandemic can be contained and controlled with existing tools. However, continues Dr. Tedros, we note that all countries agree to focus on testing and diagnosing COVID-19. Since the start of the COVID-19 pandemic, the World Health Organization has focused on testing and diagnosing COVID-19. The World Health Organization has provided countries with the tools to do this. Since the appearance of COVID-19, the World Health Organization has provided, as of January 13, 2020, the first publications concerning these tests. Since that date, the World Health Organization has provided millions of tests, methods, and diagnostic products for COVID-19. The World Health Organization has worked with countries to strengthen their capacity to master these tests. Now all African countries, for example, can test for COVID-19. But the World Health Organization still needs better, more numerous, easy-to-use, cheap, reliable and fast tests. This makes it possible to better orient and take charge of patients. In September 2020, the World Health Organization released its system and diagnostic products for COVID-19. This is because many manufacturers around the world offer products that can diagnose COVID-19. The World Health Organization, the Global Fund and other partners have evaluated more than 50 diagnostic products, including those that the patient can self-administer. Once these tests are validated and approved by the World Health Organization, they could be integrated into national country strategies. The Solidarity trial is an international clinical trial that is believed to help find an effective treatment for COVID-19, established by the World Health Organization and its partners. This is one of the largest controlled trials for treatments for COVID-19. Nearly 12,000 patients participate in 500 hospitals in more than 30 countries. The Solidarity trial assesses the effect of drugs on COVID-19 patients' death, the need for respiratory assistance, the length of hospital stay. The trial compares treatment options with conventional care to determine their relative effectiveness against COVID-19. This trial, for which patients are recruited from several countries, aims to determine whether one of the drugs increases the chances of survival or decreases the need for ventilation or the length of hospitalization. Other drugs may be added to the trial as new material becomes available. In general, until the evidence is sufficient, the World Health Organization advises physicians and medical associations against recommending or administering to patients with COVID-19 these treatments whose effectiveness is not demonstrated, and the taking of these drugs in self-medication. The guidelines of the World Health Organization. The provisional results of the Solidarity trial were published on October 15, 2020. It was found that the 4 treatments evaluated, remdesivir, hydroxychloroquine, lopinavir, ritonavir and interferon, had little or no effect on overall mortality, initiation of ventilation, and length of hospital stay in inpatients. It is planned to evaluate other treatments as part of the Solidarity trial to continue to seek effective treatments for COVID-19.
The coronavirus pandemic is expected to cause a surge in deaths from another deadly virus, HIV. There are fears that there could be an extra 500,000 AIDS deaths this year alone.
WHO is deeply concerned about the impact of COVID-19 on the global response to HIV.
More than 70 countries say they're at risk of running out of the antiretroviral drugs needed for the daily management of the condition. What's more, HIV patients who aren't on ARVs are thought to have an increased risk from COVID-19. So how can we protect people with HIV during the coronavirus pandemic? The coronavirus outbreak is endangering the fight against HIV, and that's becoming a growing problem, particularly in African countries, where many lives depend on antiretroviral drugs, the very ones now becoming scarce because of the pandemic. DW's Adrian Krish reports from South Africa.
Tembi would have preferred not to come to the clinic today because of the coronavirus and to avoid questions from neighbors. Tembi is not her real name. She prefers to remain anonymous.
Are you ready?
She is HIV positive and wants to make sure her 1-year-old daughter does not become infected.
My family knows.
But your friends?
No. Because they like to gossip. So people, they judge you. It's wrong, it's not right, because you don't know your future, what will happen to you after all. So you don't need to judge person.
1 in 5 mothers in Khayelitsha township is HIV positive. A few years ago, 2 out of every 5 children also had the virus, but now the chances of HIV being passed on at birth are less than 5%. South Africa has made significant progress in the fight against HIV. The government pays for the medicines. and aid agencies like Doctors Without Borders help with education programs. In normal times, a group of mothers with HIV meet here once a month, but the corona crisis means the meetings have been cancelled.
Our mothers do gain a lot from the group sessions, discussing with peers and having also time to discuss with the facilitators and things like that. So now that the group sessions are not happening anymore, it has really affected postnatal clubs.
The medics now counsel the mothers on a one-to-one basis. HIV is still a serious problem here. The hospital is much emptier than usual. Because of COVID-19, many patients avoid hospitals and therefore don't have access to their medication. Experts believe that this could have a strong negative impact on HIV/AIDS, but also tuberculosis patients in the future. Tembi knows her medication significantly increases her own life expectancy. Her hope is that in the future, HIV and corona will no longer be a danger to her daughter.
Earlier, I spoke to Dr. Shannon Hayter. She's the Deputy Executive Director of UNAIDS, the Joint United Nations Program on HIV and AIDS. Just this week, her organization, along with more than 70 other countries, warned that the coronavirus pandemic could lead to a dangerous shortage in life-saving antiretroviral drugs. I asked Dr. Hayter why.
Yeah, you know, we have sort of these colliding epidemics right now of HIV and COVID, and we have to make sure we respond to both. And so, number one, on a really practical level, we've started to see some really good and creative, resilient approaches to making sure services continue. But on the larger scale, we are absolutely seeing the risks for drug treatment shortages. There are barriers in some cases to raw materials getting into countries so that production can happen. There are barriers to produce drugs getting out of countries and into the countries that need them because of COVID restrictions. And so it's a really important dance to be monitoring where shortages might be and problem solving to make sure they don't interrupt treatment.
Now, what would these shortages mean for people living with HIV in mainly developing countries?
Well, you know, we've made tremendous progress in the HIV fight since the beginning, and we just put out new numbers that showed over 25.4 million people worldwide are now on HIV treatment. But we really decided to say, well, how bad could it get with COVID? What happens, for example, if there were a 6-month interruption in all HIV treatment services in sub-Saharan Africa? Now, we don't plan on that happening, but we have to look at that sort of bad case scenario. And doing some modeling along with WHO and the HIV Modeling Consortium, we found that a 6-month interruption in treatment services would lead to an additional 500,000 deaths from AIDS in this year alone. That would double the number of deaths in sub-Saharan Africa and actually set us back to 2008 response levels. So we lose a decade of progress in just 1 year.
Shannon, are people with HIV more likely to suffer from a severe COVID-19 infection?
You know, we're learning as we go on that. There is some new data out of South Africa, which is one of the first countries affected by COVID that also has a very large HIV epidemic. And they are seeing that there is some additional severity in people living with HIV who get COVID. It's not as bad as for people who have diabetes or existing lung disease, but of course people living with HIV are aging and have those things too. So it is particularly important that people living with HIV take precautions to try to avoid getting infected to begin with, and that we hope to learn more as, you know, treatments evolve, vaccines evolve, etc.
See you soon.